Did you know that every 4 minutes someone dies of a stroke? Every 4 minutes. 80% of strokes are preventable and no one is immune. So do I have your attention this morning? Here to educate us about the risk factors associated with strokes and how to prevent them, so important, is Dr. Ralph Sacco, former president and spokesperson at the American Heart Association, American Stroke Association, and professor and chairman of neurology at the University of Miami Miller School of Medicine. Good morning and welcome back.
Good morning, glad to be here. Olga.
I'm so glad you're here because this is so important to talk about. We're going to talk about risk factors and that statistic, 80% preventable. I mean, you can do things, but first, doctor, everybody hears out there a stroke, and they hear it all the time. My mom had a stroke, my grandmother. What exactly happens?
So a stroke occurs when there's a disease or a problem with an artery supplying or within the brain. And this artery can get blocked, and then there's lack of blood flow and nutrients to the brain, or it can rupture and bleed in the brain. And that causes problems with the brain. When we have problems with the brain, we have problems with our body. A stroke occurs basically when arteries in the brain have problems.
Correct me if I'm wrong, there are different types of strokes?
Well, that's right. Not all strokes are the same.
Correct.
The majority of strokes are blockages of arteries, either tiny arteries, larger arteries that get hardening of the arteries, or a little clot breaks off and then blocks an artery in the brain. But then there are some strokes that are bleeding strokes, and then there are some strokes that are warning strokes, that we call transient ischemic attacks or mini strokes. And then, unfortunately, there are many strokes called cryptogenic, strokes of undetermined cause, where we do everything we can and we still can't figure out what causes them.
And it's important to note that people sometimes think, oh, older people have strokes or men are more likely to have strokes. Anyone can, right?
Right. Stroke can happen at any age. In fact, there's some really alarming statistics. 18 to 34-year-olds, millennials, are seeing an increase in the number of strokes.
18 to 34.
18 to 34.
Men and women?
Women actually die and are disabled by stroke more than men each year, and African Americans and Latinos are at a much greater risk for stroke.
So what are steps that we can do, doctor, to help prevent it, since we just realized that 80% are preventable? What can we do?
Right. There's many things you can do. First of all, if you've had a stroke, we need to do everything we can to prevent another stroke.
Of course.
Regardless, everyone needs to follow the American Heart Association Life Simple 7. There are 7 key factors. 3 of them are your numbers: blood pressure, cholesterol, and glucose, blood sugar, diabetes. We know we can treat these things with medications. We can also do behavioral modifications.
And so easy to detect.
And easy to detect, simple blood tests, see your doctor, get your blood pressure checked.
And that's it. 4
of them are behaviors: never smoke, be physically active. We need to get out there and walk, run, do some exercise. Make sure our weight is under control, and most importantly, diet. Follow the American Heart Association healthy diet. There's so much we can do with diet to keep our blood pressure, get our weight down, get our cholesterol and our blood glucose under control.
And there's so much we can do if someone is having a stroke, and the signs are there. You have a great acronym that can help anyone out there detect it. What is it?
That's right. FAST. F-A-S-T.
Break it down.
F for face. If you have drooping of your face, you ask someone to smile and they have one side of their face isn't working as well. A for arm. If their arm is drooping or they have one side of the body is weak. S for speech, slurring of the speech or trouble getting words out. And T, critical, time. Time is brain. Every minute we delay treatment, brain cells die irreversibly. Call 911 urgently. F-A-S-T, fast. Call 911 urgently if you see these symptoms.
And making that call even seconds too late can make a difference, right?
It can make a huge difference.
We're talking death sometimes.
Death, disability. Now there's so much more we can do if you get urgent attention, drugs and devices to really change your outcome with a stroke. But you got to call 911. It has to be an urgent attention. Fast is important.
And the name is just so perfect. Thank you so much, doctor.
Great
Appreciate your time. You come back again. And to learn more about stroke prevention, go to strokeassociation.org. That's strokeassociation.org, or go to our website, thebalancingAct.com. Fast.